Sickle cell disease is still with us, even though it was first identified in 1910. Treatments that make the disease more manageable are currently available, and gene therapy may eventually be a cure. However, today people living with sickle cell disease are routinely treated using blood transfusions. In the following video, you will hear directly from a young sickle cell patient what blood transfusions mean to her. There are 3 things we want you to learn about from this program. First, you will understand what sickle cell disease is and how it affects the body. Next, we will look at how blood donations can make a significant difference. Finally, we will describe ways in which you can help those with sickle cell disease. Sickle cell disease is caused by a single gene defect that causes proteins in the red blood cells to deform and twist the cell into the crescent or sickle shape that is characteristic of this disease. You need 2 copies of the defective gene to have the disease. If you have only 1 copy of the gene, you would have sickle cell trait. If 2 people with sickle cell trait have children, there is a high level of certainty that some of the children will develop sickle cell disease. Red blood cells transport oxygen throughout the body, and this deformity severely affects their ability to pick up and release oxygen. The sickle-shaped red blood cells tend to clump together and stick to the walls of the blood vessel, which blocks the vessel and reduces blood flow. Additionally, these deformed cells become damaged and fall apart easily, so your body has fewer healthy, oxygen-carrying cells. The reduced blood flow and lower oxygen levels due to sickle cell disease can cause organ damage throughout the body. The sickled red blood cells die quickly, which results in a low red blood cell count or anemia. Those with sickle cell disease are prone to having strokes, tissue and organ damage, excruciating joint pain, and persistent anemia. Although it may appear that sickle cell disease predominantly affects people of African heritage, the fact is that people from some Hispanic countries, India, and the Middle East can also develop sickle cell disease. As best as we can tell, about 100,000 people in the U.S. are affected with sickle cell disease. All babies born in the U.S., regardless of heritage or ethnicity, are tested for sickle cell disease as part of routine newborn screening. 1 in 365 African heritage births are children with sickle cell disease. Blood donation makes a difference for those with sickle cell disease in a variety of ways. Transfusions of healthy red blood cells that do not sickle can give patients relief from disease symptoms for periods. This helps to keep organs healthy and reduces the pain that many sickle cell patients often experience. Finding closely matched blood donors is very important for sickle cell patients. The closer the match, the longer the transfused red cells will last in the body. The commonly known blood types are A, B, AB, and O. Within those blood types, there are many different subtypes. One of these subtypes is over 10 times more common in people from African and Caribbean ethnic backgrounds. This subtype is also found in people from southern India and from some Middle Eastern and Spanish-speaking regions of the world. Those with sickle cell disease receive the greatest benefit when blood type matches are as close as possible to their own. When more donors of African heritage donate, it increases the availability of matching subtype blood for patients with sickle cell disease. You can help those living with sickle cell disease in many ways. When you donate blood, plasma, or platelets, you increase the possibility that sickle cell disease patients will have the blood supply they need to have more normal lives for a time. You can also hold or support a blood drive or help us to transport blood to local hospitals. When you work to build awareness of sickle cell disease and the value of blood transfusions, you can encourage others to donate blood. Most importantly, when you donate to local organizations working to increase awareness about sickle cell disease, you make a difference for patients and their families. Rolling up your sleeves to donate helps you as well. Each time you donate, you get a free mini health screening. Your vital signs such as heart rate and blood pressure are checked, and your hemoglobin is measured to help determine your iron levels. Blood donation stimulates the production of new blood cells in the body, and regular blood donation is linked to reduced blood pressure and lowered risk for heart attacks. Blood donation is one of the best ways to help others. 1 pint of blood can save up to 3 lives. African heritage donors can make a difference for those with sickle cell disease. Please contact the Red Cross to learn if you are eligible to donate, and if you are, please schedule a donation appointment as soon as possible.